Hi, guys. We are Beyond Fertility, a holistic approach. I'm Dr. Robin Calabrese, and I'm here with Corrine Baker, and we are talking blocked tubes, part 1. So we are very excited to kind of go down this road. We have a couple of segments that we're going to kind of break everything down. The first segment is how do you test for it? How do you know if you have blocked tubes? What are symptoms? And there are 3 key tests that we can use to see if you have blocked tubes. The first test is an X-ray test, which is called the HSG. And Corrine can go in a little bit more about what actually goes in with it.
So the HSG is a test that I even did. So I experienced it myself. But the HSG is where they pretty much insert a catheter and it has dye, which they shoot into your uterus, into your cervix, and it goes into your fallopian tubes. And the purpose is to see, is the dye going to spill out of the fallopian tubes? And that lets you know whether or not the tubes are open or if they're blocked. If nothing comes out, then you know that the tubes are blocked. If they spill out on one tube or both, then you know, okay, there's an opening there. But it at least gives you an indicator as to whether your tubes are blocked or not. And it is a procedure that you will do in the office at the fertility clinic, or if your OBGYN does it, if they treat fertility. It's an outpatient procedure. It doesn't take long.
Are you awake or do they put you to sleep for it?
No, you're awake for it. They give you some medication to ease any discomfort, but you're awake for it. And it's pretty quick. It doesn't take that long. And once you're done, then you go home. But at least it gives a good indicator also if there's any type of blockages also in the uterus as they're shooting the dye, they can see that. But the main goal is to actually focus on the actual tubes. Will the dye actually spill out? Which is an important indicator. Are they blocked or not blocked?
Did you have pain after the procedure?
You can have some cramping. Because I had some cramping afterwards. But they're mild, kind of like menstrual cramping type thing is what I encounter. You take like 2 Tylenols and you kind of just rest the day and you're good. Some people don't experience much discomfort with it. You might have some bleeding a little bit, but not a lot. But it's not anything like major. It is a very mild outpatient procedure. And you can tolerate it pretty well.
Oh, good. So that's very good. See, this is why this is kind of a cool discussion, because some people in this discussion, we have experienced a lot of what you guys may experience. So definitely always, if you have questions about this stuff, you can send us an email and ask us different questions. The 2 other tests that we want to talk about is an ultrasound test and also the keyhole test. Again, these are surgical procedures that you will receive at either your fertility clinic, OBGYN, or either primary care that has a surgery center, something along those lines. But those are the ways to find out if there is a blockage and where the blockage is. Now, some of the symptoms that you may experience prior to even asking if you have blocked tubes is really just having pain in the pelvis area or belly. Now, this is not pain that you would experience during a menstrual cycle, but it will be more intense during your period, or the pain will be constant. And so these are things that you kind of want to look for. They'd be like, am I having more pain throughout the entire cycle? That is inflammation that is happening in my lower pelvic region, or is it cramps that are exemplified or lasting longer than they should? And we're going to go to the next one, which is causes. This is, referrals. I forgot. This is live is fun. Referrals.
We're learning as we go. So, this is all new for us. Just want to get the information out here to you because it's so important. And, a lot of you call or you'll email me and you say, like, I have blocked tubes and I just want to conceive. And or some of you may not know for sure and you want to find out because you're not conceiving. So you can always contact us and we will give you a referral to a fertility clinic in the Central Florida area who we are confident about their work And so we definitely refer only to those who we know we're confident with. Either we have experienced them ourselves and been there, or they are practitioners who we know that we can trust to send you there. So you can always contact our office for those referrals, and Dr. Calabrese's office at Whole Family Healthcare. They do also a lot of testing for you. So if there's additional testing that you would like, blood work and stuff done to find out additional causes of the blockages, they are great at doing the lab testing also.
And that's why I like this stuff. So blood work is always going to tell you what the most important things are going on in your system. So let's get into causes. I know causes can always be, it can be happy, sad, and different things, but you have a history of pelvic inflammation. Now, how you got that inflammation, there can be a number of different ways that can happen. If you had a previous appendix burst, because if you had an appendix burst in your past, there could be scar tissue, there could be toxicity that is causing one of the tubes to be blocked. Sexually transmitted disease is one. Gonorrhea and chlamydia are two big factors. And one thing that Karina and I really want to say is this is honestly a judgment-free zone.
Yeah.
We just want to make sure that you get the help that you have to make sure that you can clean it out so it doesn't cause issues like cancer and different things in the future.
Right.
Endometriosis is a huge factor as well. And if you don't, we'll talk more about endometriosis in another video, but just short, endometriosis is an overgrowth within the uterus of things growing outside of the uterus as well. Right. If you had a history of abdominal surgery, now some of my patients who are now in childbearing years were born with their intestines outside of their body. And so because of that, they've had to have surgery at a young age, which then grew up as having inflammation throughout their lives and now has more issues.
Right. And you see that, I always encourage women to just make sure you're following up with a gynecologist and getting your annual well women's exam. That is so important because oftentimes things will go undiagnosed and they may be overlooked because they didn't have symptoms of certain sexually transmitted diseases or whatever. And so you overlook it in your younger years. And then as you get older and now you're in childbearing age and you decide, okay, I want to start a family, you may run into challenges of conceiving. And so it's so important to make sure you're following up, getting your annual well women's exam, your pap smear, get that done every year and find out, the health of your body so that you can ensure that, you can have children later on. And like Dr. Calabrese said, we're a non-judgmental business here. We don't judge you. So when you come to us and let's say you do have a sexually transmitted disease that has caused you to have blocked tubes or whatever your situation is, we're not here to judge you. We're here to help you in any way that we can. So just know that, whatever your cause is, if we can help you to treat that naturally, we will do that naturally. If it needs to be done surgically, we will refer you to those who are trained to do surgery because not all tubes, in all honesty, can be treated naturally, depending on the blockage and what it is. There's need to be surgery, and that's just the reality of it. And we want to give you all the options. If we can do it, we can do it. If we can't, we'll let you know we can't. And we will definitely refer you on so that you can treat the issues, and move forward and have a family.
Because that is our main goal. And it's like, and sometimes I know the word surgery can be uncomfortable and scary to people, but if that is the one thing that is stopping you from having a child naturally, is just basically, to more or less clean the pipes, if you will. I mean, these are all options, and through holistic approaches, we can help you pre and post surgery as well to make sure that there's less inflammation that can happen. So I said, even though if you had your heart set on doing everything naturally, there are ways to do it naturally with involving Western medicine as well, and then ending up having everything naturally. And these are all discussed within consultations, between you and your partner, you and your spouse, whatever, on what would best options work for you and your family.
Right.
The next thing is, can you get pregnant with blocked fallopian tubes? And I'm going to let Karine take this one.
Yes, this is something that we get asked all the time. Can you get pregnant with blocked fallopian tubes? And the answer really is yes and no. Because it just depends. If, let's say, there's only one tube that's blocked and the other tube is healthy, then there is a 50-50 chance that you can. There's a great possibility. If both tubes are blocked, can you get pregnant naturally? Then there's probably going to be a challenge where you can't. However, it doesn't mean that you cannot get pregnant if you have good quality eggs, and if you want to do the IVF process. That's an option there where they can go in and actually retrieve the eggs and out of the ovaries, and that way you can actually go through IUI, IVF, and conceive that way. So there are some options. It just depends really on which will work best for you. And that's something that you really have to think about and decide, what's the best option for me? Do I want to try to do it the natural way? If that's the best approach for me, will that help? Or do you want to move to another approach that's more conventional or traditional? IVF, IUI, But is it possible?
Yeah, will help you. And that's the cool part about Beyond Fertility, a holistic approach. Even though we do promote holistic options, we are here to help support you in any decision, because, a pitcher just doesn't go on the mound and have no one else out there. You know what I mean? You just don't go into that surgery or go into childbirth without having some sort of team, whether it be family, whether it be friends, whether it be anything. We never want you to feel alone through this process. And sometimes it's very important to have advocates who are either currently been through the process or working with people who are going through the process, and just being able to create, like I said, that team approach for you.
Yeah. And support is so important with this whole process, because even if you have blocked tubes, you may be feeling so discouraged and overwhelmed, like, will it ever happen? Will I ever have a family? You may feel like the clock is ticking. What do I do? And so, that can place a lot of pressure on you, and not knowing, like, where do I go from here? What are my options? What do I do? And so, that's our goal, is to really just to educate you, give you the options, and let you know that you do have options. Don't ever feel like you don't have an option. There are options available to you. You just have to decide what is best for you in your situation, what approach you want to take. And like Dr. Calabrese said, we're all here for the holistic approach. But we respect also Western medicine. There's a place for that. And we're not here to ever say that Western medicine is not important. They are important. There's a place for them. There's a place for us. And we can actually work together. And together, it's so much stronger together. We can work together. It really, we can really help the body to do its job at its finest, and then they can do their job, and they can really work together and helping you with the blocked fallopian tubes, and to getting you to the place where you want to be, which is a healthy pregnancy. So,
and now we're going into my favorite part: treatment
options and benefits.
And I said, this is like where I really think, that Karine and I really shine, and just all the treatment options that we have for you, or we have at our disposal to get you to that place where you want to be. And the cool part is that you just don't have to be local, because we can, like, going back to the referrals that we had before, we can start referring, nationwide and different things like that. So I said, it's just, even if you're watching this video, you're like, oh, I wish I was local, we have people that we can refer you to as well. So that should never stop you from sending an email, reaching out on social media, anything like that. So
we've sent stuff to people who are not even here. Like, we've shipped herbs and we've done stuff. So, you don't have to feel like you have to be here to work with us.
This is so true.
Yeah.
And kind of going down the road. So what are some of the fun treatment options? So number one, my favorite, traditional Chinese medicine. Now, what does that mean? It's acupuncture, Chinese herbs, moxa, cupping, and a multitude of different things that kind of go into that. And there is different ways. Now you guys could be searching on the internet at night, what is good. And there could be singular Chinese herbs that come up. And actually Karina and I were just having this conversation. It's not necessarily that you would just take one Chinese herb. You have to figure out what's best for you. You guys, every person has an individual plan. Every person, because if it was cookie cutter, it would have been one and done and everybody would have children and no one would have to go 14 rounds of IVF and everything like that.
I mean, doctors even struggle with getting the formulas right for IVF, even with the medicine. So, even with traditional Chinese medicine, it's a formula and it's not one stop, it's not cookie cutter. It doesn't fit everyone. It's not one size fits all. It's the same with IVF. When you go to IVF, they give you a treatment plan protocol and they tweak it along the way. Mm-hmm. And you're not going to have the same amount of gonadotropins as the other person, and it's different because I've had every single one of these treatment options that we're going to discuss. And I can tell you right now, so I know what that's like. But it's not going to be one size fits all. So please be careful when you're on the internet and you see these things pop up and they say, oh, this treats blocked fallopian tubes. Be careful because everything in there may not be for your specific situation because there's various causes as to why your tubes are blocked. And so you can be treating it with something and it will have no effect on you. And then you'll say, well, it doesn't work. Well, it wasn't for you. So you have to find the actual thing that works. And Robin said it best, when you have to get it customized to you.
Mm-hmm. Oh, definitely customized. And just kind of like a little, customize and understanding blood work. I mean, these are things, if you want hard evidence, it truly is in your blood and nutrients, and it'll tell you what's going on. Mm-hmm. And there are ways that your body will tell you what it needs. The next thing is also really awesome is fertility abdominal massage. This may seem kind of like frou-frou to some people, but it has been tried and tested in many different cultures in many different countries over and over again about the benefits of this, not only just for blocked fallopian tubes, but for many types of abdominal situations that are going on, even after childbirth and C-section. We'll get into that later, but just keeping that area warm and lubricated. And if there is a blocked tube, and as the massage is happening, it could naturally just release because the rest of the body is compressing against itself. I mean, if there's so much science-based information out there about how that will help and how opening up the organ systems, opening up the fascia, opening up even just and separating that skin from that skin, muscle, tissue, bone, just to be able to allow just for circulation to happen. Because within a traditional Chinese medicine model, when there is a blockage, which is called qi stagnation or qi blockage, there's no blood going there. And blood is life, life is blood. And the more that you start to bring blood into the system, into the areas, your body will take care of things naturally. Right. Now, going back, this is where Western medicine comes in. If we've done all that stuff like that and we're still having issues, this is why Western medicine becomes our friend. But through a holistic approach, we've built you up, your immunity, your mental, your emotional, everything that goes along with that in order to receive some procedures. Or it could happen that you just get pregnant because things have started to move around naturally. Do you have anything you'd like to add?
And castor oil packs with the fertility abdominal massages. Castor oil packs are, I don't even know how to rate. They are great. They are definitely helpful if you do them correctly. And you have to know when to do them. You cannot do castor oil packs all month long. There's a window that you can actually do it in, especially when you're trying to conceive, because you can actually, if you do it wrong, you can actually miscarry. You don't want that problem. So you have to know when to do it, the window to do it in. And that castor oil is so beneficial because it really helps to get things moving. It flushes out and helps to break down scar tissue and things. So we do that. That is so beneficial to women who have blockages.
Sit there and think castor oil, that's so old, but they're old because they've been used over and over and over again. It's like the great-great-grandmother's recipe that's still the same. It's it's not saying that it's an end-all. Even like Karine said, even with IVF, they're still trying to work out the recipe. Well, we're just trying to work out the recipe with you. Supplements are fun. And I said, there is a couple of supplements that, we recommend. And again, this is not things that you just take individually. There's usually a rhyme or reason, because with your cycles and with your cycle in the 4 phases, there are times within the cycle that these are important to take. But some of the supplements that we've recommended are simple. Vitamin C is always wonderful. Yeah. Turmeric or curcumin. Yeah. Ginger, garlic, and vaginal steaming. I know it's like, what? Vaginal steaming? Mm-hmm. But it truly does work. And there's a couple of different options that you can see that you can do your research on. Kareen, have you experienced vaginal steaming before?
I have not done it, but you know what? I will. I
have done it before, and I did it before. I have my gynecological history has been fun, but who are we if our gynecological history hasn't been fun in the past? But I have done it before, and I have to tell you, at first, anything like that feels weird. They call them vaginal facials. They call them vaginal. There's many different things, but it is probably one of the most relaxing things that you could do because of how much it eases pain. And going back to symptoms of blocked tubes, when you talk about pressure, pelvic floor pain, lower pelvic pain, belly pain, you're going to start to notice that putting heat up in there with these vaginal steamers is going to help relax all of that. And then your body may take care of the inflammation on its own. So I said, these are things that you can just try on your own. Dietary change.
Yeah, that's huge.
I can't go anywhere with that. That's just, yes.
It's huge. You have to, especially when you're doing herbal. Yeah. If you're not willing to change your diet to accommodate the herbs, the herbs are almost going to be like fighting against what you're doing. And herbs work best in a like an alkaline, natural state environment, but you have to work along with the herbs. So you have to make sure that you're drinking a lot of water. Like hydration is so important, so important. It helps to improve blood circulation and keep the cells hydrated. It helps to reduce disease also, if you're hydrated. But it also
stay hydrated,
Yeah, that's huge. Skin, hair, nails. It's like, gosh, you need hydration. And that's huge for even trying to conceive. And you got to have hydration for blood circulation to the uterus. But definitely dietary, reducing your sugars and alcohol, smoking, making sure you're eating a healthy, balanced diet of vegetables and getting enough of your proteins. And you have to really balance your diet. But on top of that, making sure that you have the right type of foods for you is important, because everyone cannot consume the same diet and be okay.
This is eat right for your blood type. This is why the blood is so good, and understanding, what your blood work is telling you, micronutrient testing, food sensitivity testing. These things kind of help guide you, because, with dietary changes, you could have, because there's 3 types for dietary stuff. There's IgG, IgA, and IgE. And we'll get into that much farther, but just so you know, IgE you probably know because that's anaphylactic. You would have known at this point in your life, if you're in your 20s, that you are anaphylactic to something. Now the IgG and the IgA, those can just be more inflammation things that are built in over time. Mm-hmm. And understanding blood work and understanding your blood and understanding that stuff can really help make dietary changes that work for you.
Yeah. And I think in a future, one of these, we're going to have the actual nutritionist on, and she's a functional integrative nutritionist. And so she'll be able to go into that a lot more in depth.
Yes.
Like if you ever experience eating something and then afterwards you're sluggish and you just don't really understand why, it's like, why do I want to go to sleep now? It's like, I just had lunch. Mm-hmm. It's certain things that we eat that really does that to you. So if it does that to you, where it makes you feel so exhausted and you just want to go to sleep, imagine what it's doing to your reproductive organs.
And slow everything down.
Yeah. So you have to really get with someone who understands nutrition, especially when it comes to reproductive, because not all nutritionists are created equal, because certain foods that you eat can cause more inflammation and damage to you. And that's what they would recommend. And then that is really what's your problem, why you can't conceive. and what's causing the blockage and maybe even making it worse.
So, I mean, every time we do these, I learn so much and more information, and I hope that we've been able to teach you some stuff. We are obviously, you notice this is part 1. We do have part 2 that we will do the next week. And, you know, what should you do next? That's always the question. So let's say you've done things. So what are my options? But you'll have to come back next week and find out.
And we'll definitely share that with you next week, what to do next, because it's so important to make sure that, you know, now that you have this information, where do you go from here? We don't want to just leave you hanging. So we will definitely share with you where to go from here. Now that you know this, what to do next. So I would just say, you know, make sure that you follow us on Facebook. We have a Facebook page, Beyond Fertility Holistic Approach. You can get in contact with us there. Also, if you want to email us privately, you can do that, beyondfertility2@gmail.com, and we'll check our emails and respond back to you. So you have 2 ways of getting in contact with us. And if you have questions or anything, please, you know, email us, message us, and we'll definitely reach out to you and help.
I'm excited.
Yeah.
Thank you so much, and we look forward to hearing you next week. Bye, guys.
Bye-bye.